If the pandemic experts have it right, the coronavirus is going to be with us for another 18 months. However, many chiropractic patients can no longer wait to go back to see their favorite chiropractors. How do you, as a chiropractor, effectively protect yourself, your team, and your patients during this special time? To answer this question, nothing beats the tried and true secrets used by the leading doctors during this pandemic. Now, today we have the great pleasure of having a true leader of the chiropractic profession, my longtime friend, Dr. David Gryfe, to share his secret that he used to protect himself and his team and all of his patients during this pandemic while he was treating 40 patients a day for 2 months now. Dr. Gryfe is the former chairman of the Board of Governors of the Canadian Memorial Chiropractic College. He's the vice president of the World Spine Care Canada. He's also the leading figure in many other national and international chiropractic organizations. So without much ado, let's welcome Dr. David Gryfe to share his secrets.
Thank you, Patrick. Thank you for inviting me to speak, and it's a real pleasure to be here with you. So the first thing that I want to raise is it shouldn't be a secret, in fact. When we went through SARS, and anyone who is old enough to remember that, and it's not that long ago, but it is some time ago, the final outcome of the investigation on how we dealt with SARS, the recommendation was to practice in any case where we have potential epidemic or a pandemic is to practice the precautionary principle. Mm-hmm. And what that means is to take more precautions than you might feel are necessary at the beginning until you understand the situation better. And then when you understand it, then you start to remove some of the restrictions if they're not necessary. Take all of the restrictions that you need at the beginning. So, we did see maybe not an immediate response, but a very quick response here. As soon as we saw cases starting to come to Canada, the various provinces and the federal government jumped on very quickly, and we had a lockdown. And so all non-essential services were shut down for a period of about 2 months. During that time, you could still get groceries, and police and fire departments were still working, and urgent and emergency care was still being provided, but people were being very, very cautious. And we know that in some cases, that was actually to their detriment. People were not necessarily following up on the care that they needed, especially when it came to cardiac cases and so on. We've heard of cases where people were not following up because they were afraid to go out.
Right.
And so there are obviously ups and downs, goods and bads about practicing it to that extent. But as we got more comfortable, as we started to see that we were getting control of it, we moved into stage 2 in Ontario. And with stage 2, we got permission from the government and from our regulatory body to return to practice in a careful way, a progressive, careful way. So what that meant, and in my mind, that meant now is where we start practicing the precautionary principle in practice. And so
that means that at this stage, the clinic was open, physically open to patients.
Okay. That's right. So to begin with, I was asking if there are people who have what they considered to be emergencies or severe unremitting pain or some dysfunction that they considered to be extremely important, to call the office, and they were being notified through our electronic health system that our office would now be taking appointments. And so then we arranged for one patient per half hour. They had to be pre-screened by telehealth first. So, asking all of the pre-screening questions about contacts with COVID patients, travel outside of Canada, any symptoms, including sore throats, difficulty breathing, a new cough, lethargy, all of the strong and all of the subtle signs in children. We know that something that happens is the cytokine storm, the systemic inflammatory reaction. So any signs of red toes, red fingertips, these are all subtle signs. So we asked all those thorough questions. And that was partly guided by ministry guidelines that they publish, as well as the self-assessment tool that the Ministry of Health in Ontario has on their website and is available for everyone. If they have any questions about their status, can go through that screening, and any positive answers to those questions will prompt you to go get tested, right? So we used all those guidelines in asking our questions. Right. If a person could answer no to all of the screening questions, they were then permitted to book an appointment.
Oh, okay.
So when they came in, again, we would go through screening questions with them. We would take a forehead temperature. Yeah. And if everything checked out fine, they would be directed into a room. At that point, at the early in my return, not only was I, wearing scrubs, a mask, a face shield, and gloves, but also hand washing, between every patient, and regloving between every patient. Right. And patients were also wearing masks, and if they presented without a mask, they were given a mask at the office. Right. So we did everything, by the book in that case.
So what kind of scrubs were you using? Was it the kind of gown style scrubs, or just the kind of a normal hospital?
Yeah, normal hospital scrubs. And that's an interesting question, because they were in very short supply. And I did have some, which was good, because I ordered some and it took 4 weeks to get more at that time. Everything was back ordered because everyone was looking for the same supplies, right, as we know. Right. In any case, I would wash them every night. I'd come home, I'd put them in a cloth bag, I'd change out of my clothes at the office, right, and just throw them into the washing machine immediately in hot water, borax, laundry detergent, and wash them and make sure that they were clean for the next day of work. Right. Okay, so there was no staff in. I was doing all of the sanitizing of the room between patients. That's why we were booking them far apart. Sanitizing of the front desk, the pens, if they touched a pen, any surface that was in 2 meters of their of contact. So it was a lot of extra work, but patients were so appreciative to have hands-on care, to have face-to-face interaction with a health professional. Yeah. And, it was actually at that point still a very rare thing, for, what we would consider to be, less urgent type of thing. I mean, for the patient, it's not, unurgent. It certainly could be urgent when you have pain. But in terms of life-saving care, that's not what we were doing. We were doing care to help improve function. Right. Which is obviously very important, because the comorbidities of not functioning are extreme. Right. So we wanted to help people keep moving as much as possible.
Chiropractic is actually an integral part of many people, and if they, for a prolonged period of time, they can't go to see their favorite chiropractors. It's a kind of a mental stress alone. Yeah. On the other health issues.
Yeah. People were actually feeling very, so in fact, after the first 2 weeks where I was working alone, we reintroduced one staff member. And my first day back with staff, I worked a 10-hour shift and saw 40 patients that day. Every 15 minutes there was someone booked, and it was because there was such a high demand for that contact and for those services and for that relief that people were waiting for. Right. So, while I did keep in touch with people during the lockdown, during those 2 months, right, there wasn't the same. I mean, chiropractic really is a contact healthcare, right? It's truly a hands-on care. That's what it means. And without that hands-on component, people don't feel like they're getting the same relief. Even if they have a nice conversation with a doctor, it's not what they're looking for in chiropractic. They're looking for both the interaction and the hands-on care. Yeah. So
you were also doing some remote consultation with your clients before the physical opening during the pandemic, right?
Yes, absolutely. There were some cases with the Workplace Safety and Insurance Board where I had to follow up because they wanted updates on patient care. So we did that remotely to begin with. I contacted, quite a few patients by phone and by text and by email just to check in and see how they were doing. But it was really the people who had, I think, the most unstable conditions, in my opinion, the people who really were most in need of care that I contacted. The people who I know well, and I know how they experience gaps in their care, that they tend to deteriorate, and so I wanted to make sure that everyone was at least managing. So that was the strategy during the lockdown, and then as we came back, it's been certainly a lot more work and a lot more expense on the office, but that's really not an issue. The point is, if you practice patient-centered care, all of those concerns about your own factors have to go in the background, not from a safety standpoint, but from a self-interest standpoint. You have to put the patient's interest first as a healthcare practitioner.
Right. You mentioned that initially at the beginning stage of the physical reopening, it was very, very stressful, and to some degrees you needed some midday nap.
Yeah. So that's right. So those first 2 weeks where I was alone in the office, and there was certainly an uncertainty about the whole thing. We were just getting back to contact with the public.
Right.
And we didn't know a lot still about the virus at that point. This is like the end of May. We still had a lot of questions in terms of, do the antibodies last? Are they protective? How much asymptomatic spread is there?
Right.
So even if we screen, it's still possible for someone to be asymptomatic and to be carrying the virus. So there was a lot of uncertainty, and that creates mental stress when you're working in that environment. And so between the extra work of sanitizing the rooms in between patients, breathing through a mask, which I wasn't used to, and the mental exertion of being on top of things.
Right.
Yeah, I would work a 5-hour shift and go home for a 2-hour nap because I just felt completely wiped out by the experience.
Yeah.
What's interesting, though, is that when I came back to a full day, I felt very invigorated by that.
Oh.
Because the energy from patients of expressing their relief, of expressing their gratitude, is a part of the job as a chiropractor that is extremely invigorating, extremely inspiring, and makes you realize that with your hands and your mind and basically no tools, you can offer a very effective form of healthcare. And it's a very inspiring thing to be a part of.
Now, really make a difference in people's lives, in those patients' lives.
Yeah. If you can make someone who walks in bent over and not walking well stand up straight and walk out, singing, that's really a very obvious change. Yeah, life changing. Yes. Yeah.
So you were talking about using the masks. What kind of masks do you use? Is it just
Okay. So I've had the good fortune of having a neighbor and a friend who is an ICU doctor at Credit Valley Hospital.
Right.
So I spent a long time during the lockdown while he was seeing COVID patients, talking to him at a safe social distance, him on his porch, me on the sidewalk, asking him what his procedures were in the hospital. And so my first question is, do you wear an N95 mask all the time? And he said, no, we don't. We wear an N95 mask when there's going to be aerosol. When we're intubating a patient, we wear an N95 mask, an isolation gown, and a face shield. If we're just examining a patient, whether or not they're positive, we're wearing a regular procedural surgical mask, not the N95 mask, and gloves, and that's all. And frequent hand washing and not touching the face, and remasking if the mask gets damp or soiled in any way. And that's it. So, and I said, do you feel confident? He said, absolutely, because now as I'm going back to work day after day, something 14 days in a row for him, and not seeing practitioners contracting any virus, and even though they're dealing with COVID patients, it increased his confidence day by day to see that taking those proper precautions was enough to be protective. And that was extremely important to me.
Right. So the mask, did you use just one layer of mask or multiple layers of masks?
One layer of mask. That's all it's really recommended. That is exactly by the recommendations and by experience of people on the front lines. So yeah, you know what? If you start to do things that aren't what they were intended for, you might introduce problems that you didn't understand.
That's true.
Right? And so just use things properly, and there is a very good expectation of a good outcome. But the key is, you know, don't take shortcuts. You know, pre-screen every patient, screen them again when they come into the office.
Right.
Make sure there's social distancing in the office so patients are not running into each other at the desk or in the waiting room.
Right.
Bring them directly into a room and isolate them. Even if there's no reason to suspect they have the virus, there's no reason to take a chance. That's the precautionary principle.
You mentioned that,
take a chance.
Yeah, you mentioned that if the patients were a little earlier, they were advised to sit in a car in the parking lot, and then they had to call, then that come in.
Yeah, that's right. That is the recommendation, that if to avoid congestion in the office,
right,
have people come in at exactly their appointment time.
Yeah.
So if they arrive early, just ask them to wait, and they can be called that it's their time, or they can just wait and if they know when their time is, just wait and come in at their appointment time. So we don't have any kind of reason to try to be separating people. It's much easier if people just come in when their time is scheduled, and they can go directly into a room. When an appointment is over and the room is sanitized, I will not use that room for the next patient. I will let that room sit for another half hour and take a patient into another room. So it just gives a little more, after the sanitization, it lets everything dry, and it just gives a chance for anything to settle that might be in the air.
Right.
Not that there would be, but you know, it's just another layer of precaution, just so that we're not, you know, circulating people through the same room.
How do you do the sanitization? Do you use the kind of hard surface wipes and special wipes?
Actually, we're using an alcohol solution, 70% alcohol, and paper towels, and just spraying every surface. Right. Letting it sit, and then wiping it down.
Right.
To get the best effect, and that seems to be the recommendation. You know, that's that certainly does have a good sanitizing effect on the surfaces.
And you said that you also were using the hand sanitizers in between the patients. Right.
So patients would use the hand sanitizer when they come in. I would make a point of a thorough hand washing, and I would take more than 20 seconds and wash very thoroughly between every patient. I'm lucky that my hands don't dry up. That's just my constitution, very lucky, because I can wash my hands 40, 50 times a day and they don't get dry. It might be the omega-3s that I consume. I'm not sure what it is. It's just a lucky thing. I know that some people really struggle. Yeah, some people really struggle with hand washing and find that they really dry up. I don't use any lotion on my hands, and they are as smooth as a baby's. You know, they don't get dry. So I'm very, very lucky that way. So the hand washing, I felt, was, you know, it's certainly the superior way to go. You know, people will sometimes take shortcuts with hand sanitizer and rub it on, but not rub it on thoroughly and not get it into every crevice and just do a cursory hand sanitizing. I want to know that I'm properly washing, you know, everything up to the elbows and just get everything clean.
So let me try to recap. You mentioned the first of all is the pre-screening before the patients even get in. Pre-screening, and then once they pass the pre-screening, they're allowed to book appointment, and then
Right.
when they come to the office, they have the second screening.
Right.
And
Yes. So
then,
there's both, in that case, there's both active and passive. The passive is there's a sign on the door before they come in that
oh,
asks all those questions. And they're told, if you answer yes to any of these questions, go home and contact public health.
yeah,
Right?
that saves a lot of time. Yeah.
Yeah. But then when they come in, they're again asked, if they've been in before, asked any change in the conditions. Have you been in contact with anyone? Have you traveled? Have
Yep.
you got any symptoms? Right. So we go through it again.
So there are 3 layers of the pre-check screening.
Yes, that's right. And
Yeah.
in fact, a fourth, if you include the temperature check.
Oh, okay. Yes. Right. Yeah.
Yeah. Which of
4
course
layers.
is not. Yeah. Which of course is none of these things
Yeah, that's important.
are 100%. Right. You
Yeah.
could be completely asymptomatic. You could not have a fever.
Right.
You may not have really realized you were in contact with someone who had the virus. So all of those things are still not 100%. Right. They're good, but nothing is 100%.
Right.
And the PPE is not 100%. But if you put them all together, you get close to 100%.
That's true.
And that's the effort.
And the key is really to keep the virus out of the office.
Absolutely.
Because no matter how good your PPE may be, once the virus enters your office, it's getting tricky.
Yeah, I would say we would have to close. If we had a case, we would have to close for a time.
Oh, okay.
Yeah, because there's really no way to ensure that the office is safe. At least for a few days, right?
Right.
And a deep sanitization of every wall, every floor, every surface would have to be done.
But this never happened with you.
It has not happened. No, we've had no cases in the office whatsoever.
Great. So with all of this method, you managed to keep yourself, your team, your patients all safe and sound. What would you do differently if you were to do it again?
Yeah. Well, one thing that I think would be great would be to make it more available for patients to be in touch during that lockdown period. If we had just an open line all the time that people could have, ringed in and just said, I have a question. I want to know what's going on. I want to make sense of this, or I want to talk about my symptoms. Or I want, so an open line with patients, I think, would have been great. And I did talk to our office administrator about that. It wasn't able. We weren't able to kind of get it together in a privacy safe way at the time. But I hope that we do continue to work on that, because who knows when the next time we're going to need to enact this kind of thing. So gradually, more safe telecommunication methods were becoming available, but they came on maybe a bit too late for that lockdown period. Right. We know that there was Zoom bombing and there were problems with Zoom at the time, so we weren't feeling completely secure about Zoom, and they added layers of security themselves, right? But a bit late. More telehealth options were becoming available through different vendors, and they were adding layers of security to help that better. So we will have options, if we ever have to do this again.
Right. Okay.
Yeah. The other thing that I think is important, and it's just these little things that you hear sometimes in the news, and they appear once and then they disappear. One thing I want to just highlight is there was news that people who did very poorly with the virus. Yeah.
You mean as a patient or doctor?
As a patient, yeah. So if they caught the virus and they had bad outcomes, they found that they had low blood levels of vitamin D and or vitamin K. So the sunshine vitamin and the green leafy vegetable vitamin, right? Right. So I wish that it was printed on the front page of every newspaper around the world every day. Make sure your vitamin D and your vitamin K intake is good, right? So whether it's vitamin-enriched milk, or whether it's lots of green leafy vegetables, whether it's some sunshine, but somehow make sure that you're getting those things. Now, I was concerned, the advice to stay home was scaring people not even to leave their house. And there's certainly safe ways to leave the house. If you
To
social
get the
distance,
sunshine.
yeah,
Yeah.
if there's social distancing on the sidewalk,
Right.
or in a park,
Right.
your risk is extremely low. We know that outdoors the transmission is much less than it is indoors because of wind and because of sun and
Right.
factors that actually will cause droplets to dissipate more quickly,
Right.
and virus to be inactivated more quickly by ultraviolet rays and so on. So if we had public health messages that said to do those things, to get outside in the sunshine, not for a long period of time, not to sunbathe, but to get out and walk for half an hour,
Right.
and to eat your greens, as as an old message.
Yes.
These things probably will turn out to be protective factors. I mean, there's early evidence that they are, and there's certainly no harm in them. Why not? If there is some evidence, why not? There's no reason not to practice those good things. So if I could have announced that more broadly, that probably would have been something worth doing.
So is there anything else you would do differently?
No, I don't think so. I probably would have worried less.
That's okay.
Yeah, at the beginning, but the psychology of a pandemic, it's been well studied now, and we know that our fight and flight response, our amygdala, is not tuned for a slow, uncertain kind of threat. It's tuned for an immediate and obvious visual danger.
Right.
So when we have this invisible danger, it's inevitable that we will have a fight or flight response to something we can't see. And that is not a useful thing. That's why people were hoarding toilet paper and hoarding sanitizer, just to create a sense of control in the situation.
Right.
So, I mean, I was able to think through it, and I was using all the resources at my disposal. I was reading the Lancet Journal thoroughly. I was reading orthopedic evidence, their COVID-19 resources thoroughly. I was on Figure One, which is an app on the phone that is a forum for doctors, nurses, and other allied health professionals to discuss cases. There's a lot of COVID talk on that. So I was inundating myself with high-level conversations around COVID. And so that was helpful, because just getting solid evidence and solid knowledge was useful. Talking to doctors, reading the CDC recommendations, following the NIH guidelines, following the Ministry of Health guidelines. All those things were useful. And I think, in a case where there's uncertainty, getting the best available evidence is your best defense, right? That's where you will feel the most confident that you're getting it from a reliable source, not the rumors on Facebook, not the rumors on Twitter, not the rumors that are out, but the good, hard science and evidence. It may not be perfect, it may not even be right, but it will evolve, and that's the nature of science. As knowledge evolves, the information evolves, and we get closer and closer to the truth. We will never have perfect truth, but we will have a good approximation.
Truth. Yeah. So we all need to keep learning new things, especially in case of the pandemic. We really things that's coming to us. I do see people not taking it seriously. When I walk in the street, I'll see people blithely walking into a grocery store or into a Tim Hortons not wearing a mask. And at this point, we know that's not even legal, right? And I think, what did you miss in this conversation? What did you not hear that gives you the idea that you can do that? I'm amazed, but we have to consider that not everyone is a voracious consumer of evidence. That's true.
And so we have to be patient, and we have to educate. That's really important.
Right. So, is there anything else you would like to share with us?
I think, for healthcare practitioners, um, having spoken with ICU doctors on the front line,
Right.
my message is don't be afraid.
Hmm.
That as a doctor, you signed up for a duty to serve the health of the public.
Right.
And, if you take proper precautions, if you put patient interest first,
Hmm.
and protect yourself, you can
Hmm.
do it safely. And there isn't really a good reason to feel afraid or to feel anxious or to feel reluctant
Hmm.
to to fulfill your mandate as a health practitioner. I think it's important to develop the confidence and to develop the awareness around the techniques that are used to protect yourself and your patients and your staff. And that's what I want to impart to my colleagues is, you can do this safely.
Great, great. Thank you, Dr. Gryfe. That was very, very helpful, very, very informative, and that's really the tried and true secrets